Everybody says it happened awfully fast, but the truth of the matter is I've been hobbled for years. About 3 or 4 months ago, I started having a lot of pain on the side of the leg, and there's nothing short of a full knee replacement that'll take care of it.
Well, when my mom decided that she wanted to have the knee surgery done, I was all for it.
The doctor's office took care of making all the appointments. They sent me a packet, which I followed religiously, and they had made an appointment for me to go to the Joint Academy. I was a one-person class, so I was valedictorian.
When they came in, took her for surgery, and Tracy and I were headed off. We needed to get something to eat. And I walked through the door and I looked at her and I said, I don't have any qualms. I don't have one butterfly.
The day that I picked her up as a patient, she had thought that she was going to be going home, and she had had not a very good night.
We didn't have everything go flawlessly. Her oxygen level dipped.
The fact that it dropped so low so fast was out of the ordinary for a normal surgical pathway.
I was really reassured while they assessed and worked out the oxygen, and then as soon as they made the determination she wouldn't get released, I relaxed.
It is important that you make sure that they feel good about going home. Having people feel ready to go home is another primary focus that we do here, so that they feel great about coming to St. Luke's for their elective surgery.
So every time I hit a little bit of a hurdle, somebody was right there to tell me how to get over that hurdle. So when we waited the extra day and came home on Saturday, I felt ready.
Once it was decided she would come home, then the people that were going to help us carry on were there to explain everything.
It takes a lot of coordination to make a patient that's going to go home with any kind of equipment really feel comfortable. So I'm so grateful that we have great respiratory therapists that work at St. Luke's.
I want to explain the oxygen, because a lot of the patients get a little nervous about it when you're talking about oxygen. So I make sure they're very comfortable before I walk out the door, and know how to run all the equipment and how everything works, and if something goes wrong, that we're just a phone call away. So I like to make sure the family is very comfortable before I leave.
I felt like they prepared me so that I was ready to be the caregiver.
We had a wonderful little gal named Abby.
Phyllis is a very, very motivated individual.
Abby has been really, really super.
Before people have their knee replacement, they're given a book that has all their exercises in it. When Phyllis came on her first visit, she brought that book, and it had over a page of times and days marked down that she practiced those exercises. It makes a big difference.
It's you and your patient and that bond that you have of them knowing that I have their back, that I'm there for them.
It gives me satisfaction to know that what I did improved their quality of life, and to see them walk out the door and be independent just reminds me of why I went to school to be a therapist.
Just taking 5 minutes at the beginning of your shift with each patient to just let them know what to expect with you and get to know them a little bit, and I think that definitely builds rapport with your patient.
I think it's important that families know that when they come to St. Luke's, they're going to get the very best.
I do get to educate patients and provide them a better opportunity for wellness.
There's pain and there's discomfort, but you know that going in. So if they want to get better, I think it's a wonderful place to go.